Hello, good morning. This is Dylan Robertson from the Winnipeg Free Press. Thanks for joining us. We have a briefing today on monkeypox with Dr. Theresa Tam, the Chief Public Health Officer of Canada, as well as Dr. Howard New, the Deputy Chief Public Health Officer. We'll start with some with some statements, and then we'll take questions from journalists in English and en français. So with that, I'll pass the line. But before, we have a hard stop at 2 p.m. So let's try to keep the questions and the responses brief, please. On to Dr. Tam.
Thank you, Dylan, and bonjour à toutes et tous. We are here today to provide an update on efforts to address the outbreak of monkeypox in Canada. The Public Health Agency of Canada is working closely with international, provincial, and territorial partners on prevention and control activities aimed at containing the spread of monkeypox virus in Canada. In addition, we are closely monitoring emerging data, and as we learn more, our response and advice will evolve accordingly. On July the 23rd, following the second meeting of the International Health Regulations Emergency Committee to assess the ongoing monkeypox outbreak, Dr. Tedros, Director General of the WHO, or World Health Organization, issued a statement declaring that the multi-country outbreak of monkeypox represents a public health emergency of international concern. Our understanding of this virus is still evolving, and this declaration makes clear that the situation requires an urgent global response. Globally, as of July the 25th, over 16,000 confirmed cases of monkeypox have been reported from 75 countries and territories and areas across all 6 designated regions of the WHO. This represents a 48% increase in global cases during the latest reporting week as compared to the previous week. In Canada, as of July the 26th, a total of 745 confirmed cases of monkeypox have been reported nationally, including 346 cases in Quebec, 326 in Ontario, 58 in British Columbia, 12 in Alberta, 2 in Saskatchewan, and 1 in the Yukon. Among cases for whom additional information is available, over 99% are male, and the median age was 36 years. In line with international trends, the majority of cases in Canada reported intimate sexual contact with other men. To date, less than 1% of confirmed cases reported nationally were in females or people under 20 years of age. Although we are aware of international cases involving women and children, these account for 1% or less of cases with available data. Nevertheless, this is a reminder that monkeypox virus can spread to anyone through close contact with an infected person or contaminated items. While the global monkeypox outbreak is a serious concern, there is optimism that by focusing efforts in Canada and worldwide, we can seize this window of opportunity to contain the spread. Furthermore, working together, health authorities can engage individuals and community groups to employ immediate and broad efforts from the ground up. Simply put, as Dr. Tedros has said, this is an outbreak that can be stopped with the right strategies in the right groups. Working together with the provinces and territories, the Government of Canada remains focused on rapidly stopping chains of transmission to prevent the establishment of monkeypox in Canada and protect public health and healthcare in Canada. To best coordinate our efforts, we have been meeting regularly with counterparts through the Council of Chief Medical Officers of Health. To date, the Government of Canada has deployed over 70,000 doses of Imvamune vaccine to provinces and territories and continues to work actively with jurisdictions as they manage their public health response. The government is also providing treatment for case management, as well as working to secure future national supplies of both vaccines and therapeutics. Awareness is key to getting ahead of the virus. While vaccination is expected to provide protection, a successful monkeypox outbreak response relies on a variety of public health measures, including public health education, to equip people with the information they need to make informed choices. Monkeypox spreads in several ways. Typically, the virus spreads through close contact with an infected person's bodily fluids, respiratory droplets, or skin source, but it can also be spread by direct contact with their personal or shared objects. As anyone can become infected, all people in Canada should be aware of the symptoms of monkeypox infection. Anyone who may have come into contact with the case or is feeling unwell or has symptoms, including a skin rash that may be due to monkeypox, should limit contact with others and report their symptoms to a healthcare provider. Common signs and symptoms include fever, headache, muscle aches, fatigue, swollen lymph nodes, and development of a new rash. At present, focusing the right strategies to the right groups in Canada involves continuing to engage with stakeholders to help raise awareness of the outbreak and address barriers to immunization and care in communities at highest risk. Currently, this includes outreach to gay, bisexual, and other men who have sex with men, and health providers who work with these communities to help them protect their health and prevent spread to others. At this time, to lower the overall risk of getting infected and spreading the monkeypox virus, the Public Health Agency of Canada recommends practicing safer sex. Having fewer sexual partners, particularly anonymous partners, even when they don't have symptoms, can also reduce your risk of getting infected. Healthcare providers are urged to remain vigilant and closely watch for patients with any symptoms of monkeypox, which may include atypical presentations. Canadians can be confident that we have established many personal protective habits that can help reduce the risk of infection and spreading infectious diseases, including limiting our contacts and staying home when sick. As we learn more, we will continue to provide regular updates to ensure people in Canada have the information they need to stay safe. Information is also available on canada.ca/monkeypox. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Good afternoon, everyone. We are here today to provide an update on efforts to address the outbreak of monkeypox in Canada. The Public Health Agency of Canada is working closely with international, provincial, and territorial partners on prevention and control activities aimed at containing the spread of monkeypox virus in Canada. In addition, we are closely monitoring emerging data, and as we learn more, our response and advice will evolve accordingly. On July 23rd, following the second meeting of the International Health Regulations Emergency Committee to assess the ongoing monkeypox outbreak, Dr. Tedros, Director General of the World Health Organization, the WHO, issued a statement declaring that the multi-country outbreak of monkeypox represents a public health emergency of international concern. Our understanding of this virus is still evolving, and this declaration makes clear that this situation requires an urgent global response. Globally, as of July 25th, over 16,000 confirmed cases of monkeypox have been reported from 75 countries, territories, and areas across all 6 designated regions of the WHO. This represents a 48% increase in global cases during the latest reporting week as compared to the previous week. In Canada, as of July 26th, a total of 745 confirmed cases of monkeypox have been reported nationally, including 346 cases in Quebec, 326 in Ontario, 58 in British Columbia, 12 in Alberta, 2 in Saskatchewan, and 1 in Yukon. Among cases for whom additional information is available, over 99% are male, with a median age of 36. In line with international trends, the majority of cases in Canada reported intimate sexual contact with other men. To date, there is only fewer than 1% of confirmed cases in Canada are in women or those under the age of 20. Although we are aware of international cases involving women and children, these account for 1% or less of cases with available data. Nevertheless, this is a reminder that monkeypox virus can spread to anyone through close contact with an infected person or contaminated items. While the global monkeypox outbreak is a serious concern, there is optimism that by focusing efforts in Canada and worldwide, we can seize this window of opportunity to contain the spread. Furthermore, working together, health authorities can encourage individuals and community groups to employ immediate and broad efforts from the ground up. Simply put, as Dr. Tedros has said, this is an outbreak that can be stopped with the right strategies in the right groups. Working together with provinces and territories, the Government of Canada remains focused on rapidly stopping chains of transmission to prevent the establishment of monkeypox in Canada and to protect public health and healthcare in Canada. To best coordinate our efforts, we have been meeting regularly with our counterparts through the Council of Chief Medical Officers of Health. To date, the Government of Canada has deployed over 70,000 doses of Imvamune vaccine to provinces and territories, and the government continues to work actively with jurisdictions as they manage their public health response. The government is also providing treatment for case management, as well as working to secure future national supplies of both vaccines and therapeutics. Awareness is key to getting ahead of the virus. While vaccination is expected to provide protection, a successful monkeypox outbreak response relies on a variety of public health measures, including public health education, so that we can equip people with the information that they need in order to make informed choices. Monkeypox spreads in several ways. Typically, the virus spreads through close contact with an infected person's bodily fluids, respiratory droplets, or skin sores. However, it can also be spread by direct contact with their personal or shared objects. As anyone can become infected, all people in Canada should be aware of the symptoms of monkeypox infection. Anyone who may have come into contact with a case, a confirmed case, or who is feeling unwell or has symptoms, including a skin rash that may be due to monkeypox, should limit contact with others and report their symptoms to a healthcare provider. Common signs and symptoms of monkeypox include fever, headaches, muscle aches, fatigue, swollen lymph nodes, and development of new rashes. At present, focusing the right strategies to the right groups in Canada involves continuing to engage with stakeholders to raise awareness of the outbreak and to address barriers to immunization and care in the communities which represent the highest risk. Currently, this includes outreach to gay, bisexual, and other men who have sex with men, and health providers who work with these communities to help them protect their health and prevent spread to others. At this time, to lower the overall risk of getting infected and spreading the monkeypox virus, the Public Health Agency of Canada recommends practicing safer sex. Having fewer sexual partners, particularly anonymous partners, even when they don't show symptoms, can also reduce your risk of getting infected. Healthcare providers are urged to remain vigilant and closely watch for patients with any symptoms of monkeypox, and this includes atypical presentations. Canadians can be confident that we have established many personal protective habits that can help reduce the risk of infection and spreading infectious diseases, and this includes limiting our contacts, and staying home when sick. As we continue to learn more, we will continue to provide regular updates to ensure that people in Canada have the information they need to stay safe. Information is also available online at canada.ca/monkeypox. Thank you.
Thank you. And with that, we'll have just under 40 minutes for questions. Journalists on the line, please use the raise hand setting on Zoom. We'll prioritize press gallery members and
we will try to alternate between questions in French and questions in English.
Is Laura Osman with the Canadian Press.
Thank you. Hey, doctors. I just wanted to ask you about the vaccine supply. You said you're working on getting more vaccines and therapeutics. Excuse me, you've already deployed about 70,000. How many more do you think that Canada needs, and are there challenges in getting them, considering that this is now an emergency of international concern?
Thank you, Laura, for that question. And indeed, based on global estimates, vaccine is of limited supply. And there are temporary recommendations for countries who actually manufacture vaccines, diagnostics, and therapeutics. So again, it needs a global collaboration and effort from both the private sector and, of course, governments. For Canada, as I said, we've deployed more than 70,000 doses to provinces and territories. We know that they have used over 27,000. At this point, they still have enough supply, and we will be able to provide more should they need it. But Canada and other countries do have limited supplies. We were fortunate in that we had already been stockpiling the vaccine for another purpose. And so that's how we were able to get ahead. But I think for now, we're okay. And of course, we're trying to estimate the size of the population and the potential vaccine coverage required. But what we need right now is actually those in the highest risk groups, including gay, bisexual, and men who have sex with men, take up the vaccine in order to protect themselves and others. And I know that the vaccination has plateaued a little bit in recent days, and maybe with a bit more effort, we can help this group access the vaccine that they need.
Thank you. And are we expecting have we made any orders and we're expecting deliveries, or are we still at a stage where you're trying to source them?
We had already had pre-existing contracts. So I know that PSPC and the Public Health Agency colleagues are working very hard to see what is in the realm of possible, but we did have already existing contracts in place.
Thank you. Next up is Lauren Pelly with CBC. We're having an issue on the Zoom. I'm going to get the staff to hit unmute, and everyone has one question and one follow-up. Thank you.
Hi, thank you for taking my question today. We heard some similar messaging from both your team and the World Health Organization about practicing safer sex, reducing sexual partners, tracking your partners, etc. I'm wondering, as we're talking to individuals about practicing safe sex, if there is going to be part of the conversation about supporting people more who do get infected, because we keep hearing that, even at this point, if anything, it's just piecemeal supports in Canada to ensure people have any financial support, housing options, given the very lengthy isolation period. So, is that going to be part of the conversation as well, or is it more just, individuals getting vaccinated and protecting themselves?
I think in Canada, of course, accessing healthcare and supportive care is very important if you do get infected and you need hospitalizations or other supportive care, and that needs to be provided. In terms of the isolation period, we know, roughly speaking, the median or mean isolation period of incubation period is about 7 to 9 days, but it could be longer, up to 21 days, and people could remain infectious, as you said, if you got monkeypox for a number of weeks until the scabs have formed and they've fallen off. What we're trying to do is consult community organizations and the frontline healthcare workers and public health writ large in Canada, what's a sort of practical way of making sure people are protecting themselves and others, but may not have to isolate for quite that long if people can cover up the lesions, etc. So we're looking at practical and reasonable ways of doing that. But I know exactly what you mean. I think in COVID-19, governments did step up and make sure that people are supported if they need to be isolated from others. And I do think from a public health perspective, we need to be able to do that so that people can do the right thing in terms of reducing their contacts.
One follow-up question for you as well. Given that this outbreak, as you and others have noted, has been overwhelmingly spreading through sexual networks, are there any concerns, about universities and whatnot going back in session? Obviously, young sexually active individuals. We've seen a couple incidents in the States where there's possible cases tied to college campuses. Just wondering if that is on your radar at all.
I think that's a really important point. And again, working with community groups, those who are trusted by gay, bisexual, and men who have sex with men, but also, of course, in educational settings, I think that is actually very important. And we've also been working with apps, Grindr and others, to make sure people get the messaging in order to link them to the right information, and also access the vaccine and know what to do if they think they may have monkeypox. So you're absolutely right. In preparing for the upcoming university and other educational sessions, it is important to work with those institutions and increase awareness.
Dylan, you can announce the next speaker.
Hi there. I apologize for the connection issues here that we're obviously having. Next up is Olivia Bowden with the Toronto Star.
Hi there. Thank you, doctors, for being here. I just had a quick question about how many doses should be in the vaccination series. As we're hearing from some residents who've been vaccinated that they're wondering if they're supposed to get a second dose in 30 days. Is that a discussion we're seeing in the US as well? So are you anticipating that there will be a second dose for those who are getting vaccinated?
Thank you for that question. So the National Advisory Committee on Immunizations have put out some recommendations to rapidly stop chains of transmission, giving as many people as possible one dose of vaccine is deemed to be a really important strategy, especially given limited supply. But we need to continue to monitor the data to see if people are actually getting infected after that first dose. There's certainly no vaccine effectiveness study prior to, I think, the deployment of this vaccine in the Canadian context. So we're working with provinces and others to collect that information as best as we can. So I think the product is, the way that it's authorized, does permit a 2-dose series with essentially a 28-day interval. And I know that under certain circumstances, for certain individuals may be at very high risk of continuous exposure, that could be considered. But I think just stay tuned. We will, of course, have the National Advisory Committee on Immunization and other experts look at this question as we learn more. So I would say stay prepared for the potential to need that second dose, but there'll be more communication writ large by public health should that be needed.
Thanks so much. No follow-ups from me.
Thank you. The next question is Rachel Aiello with CTV News.
Hey, can you hear me?
Yes.
Great, thank you. So you were saying that an urgent response is required internationally. In Canada, is there more that the federal government should be doing at this point, given, as you said, this virus isn't exclusive to one community? Is there more of a broader Canadian awareness that needs to be happening at this stage?
I think at this stage, really working with community organizations and those who are trusted partners with the gay, bisexual men and with heterosexual men is really important, because this is what the data and the epidemiology is showing at this point. But we did want to increase broader awareness that, of course, we had one female case at this point, and we're being constantly vigilant about the potential for spread to other higher risk communities. And so I think we need to remain vigilant. Frontline healthcare professionals, if they think they are seeing patients with rashes or other potential risk factors, then get them tested. So I think that's the most important thing, is getting remaining vigilant on the front line, getting people tested in order to potentially detect the initial outbreaks, perhaps in other settings. But so far, within Canada and globally, that's not what we're seeing at the moment. Should we be doing more? I think we can. We're at the sort of infancy in understanding the spread of this outbreak. So, of course, there's much more we can do in terms of learning more about the virus, learning more about the way it's spread, and ways to protect the individuals and communities. I think globally speaking, what we have to do is learn from past pandemics and the current one. Learning from the HIV pandemic is very important, which is why engaging communities who are most impacted right at the start to find together find solutions will be our best weapon against the spread of this virus.
Right. And just to follow up, the WHO is suggesting today men who are at risk should consider reducing their sexual partners for the moment. Is that a recommendation Canada is giving at this point?
Yes. So as we said at our opening remarks, practicing safer sex, including reducing the number of sexual contacts, including anonymous contacts at this point in time while this outbreak is spreading within the community, is a recommendation. So practice safer sex, fewer sexual partners, anonymous partners, even when they don't have symptoms, can help you reduce the risk of infected. And working with the communities and the apps and the dating apps and others to try and spread that message is very important.
Thank you. I apologize again for the technical issues. Next up is Lauren Pelly with CBC News. Again, I'm going to have to ask the moderator to unmute Lauren here.
Lauren, go ahead.
I believe you're giving me a second round of questions, which I appreciate, but I will pass it on to others.
We can go to Dan Grummett with Global News. Oh, can they hear? Dan, can you hear us? Can you speak?
Hey guys, sorry about that.
We can hear you. Thank you.
My apologies. Thanks for taking my question. Provinces, as you probably know, like Ontario and BC, have launched targeted vaccine campaigns focusing on high-risk populations. In Alberta is one province that hasn't. For Dr. Tam, should provinces and territories that haven't be launching targeted vaccine campaigns at this point?
Yeah, so we are seeing, of course, different extent of the outbreaks in different jurisdictions. Some haven't had any cases, some have smaller numbers, such as in Alberta. But I think every province and territory can be at risk. So we are certainly looking, post-exposure prophylaxis is one of the key strategies, but it's very difficult to find contacts, especially when they're anonymous. So that's why the strategy has moved to pre-exposure prophylaxis for those at higher risk. And I do think that that is a strategy that can be deployed as the epidemiology evolves. But I think that those jurisdictions with the higher numbers, and Alberta could be next. I don't know. I think Dr. Dina Hinshaw will have more of the on-the-ground information. But I do know that every jurisdiction is preparing for the potential scenarios, and that they will be able to, that we have provided them with vaccine, and they should be able to provide them to those who are living in the jurisdictions.
Merci. La prochaine question.
Thank you. The next question will be Maxence Cloutier from Le Devoir.
M'entendez bien?
Can you hear me?
Oui.
Yes.
Oui, merci. C'est Maxence Cloutier.
All right, thank you. Maxence Cloutier from Le Devoir. I'd like to start with a question. Despite Dr. Tedros's announcement that this is an international incident of emergency, we are waiting for more numbers to take new measures. At what point should the government take more measures, and are there more active measures that are being envisioned? Well, thank you for the question. It's Dr. New. Can you hear me? Yes. Yes, I think that with the declaration from Dr. Tedros at the WHO, well, in our opinion, we see that in several countries there are additional efforts that need to be taken. However, here in Canada, we are well placed. We have managed the situation well from the beginning with the first cases flagged in Canada. We continue with our efforts. And if you look at the WHO's recommendation, you'll see that Canada is already well positioned. We have already started or completed many of the recommendations that the WHO has published. So, for example, we have good cooperation between the federal government and all the provinces and territories. We are exchanging scientific information and data. And as the situation evolves, we will continue to do that. We also are working very closely with researchers because it's really with our experience on the ground with vaccination that we'll better understand what is happening and if the vaccination is effective and if it's working well, and that will allow us to evolve through the future and see if we need, for example, a 2-dose regime. But we will continue to collect data on that. And also, when it comes to raising awareness, those are the two main components of our response. There's also it's vaccine accessibility and raising awareness amongst those who are at high risk to make sure that they get vaccinated, but also to change their behavior. And in our comments, we noted that it's very important for those who are at risk to practice safer sex to minimize the risk. For example, fewer partners and fewer anonymous partners in particular, even if they don't have symptoms. It's important to limit that contact and use a condom and that sort of thing. All of those sorts of behaviors can limit risk. So those are the two main aspects which will allow us to manage the situation in Canada. But it's also very important that we continue to monitor the situation with all the tools that we have to collect data and to look at what's happening in Canada. And to date, 99% of cases are men, but at the international level, we see that there are also women and children who have been infected. We've been lucky so far in Canada, but we certainly need to continue to be vigilant and continue to raise awareness amongst all Canadians, and we'll see what happens. There are concerns that we might see cases amongst other populations, but so far it is almost exclusively men who have had sex with other men who have been infected. So to sum up, Canada has done quite a bit so far, but we need to continue with our efforts in Canada, and I think as well at the international level. We need to contribute with our experience and our expertise so that we can contribute to the world, the global effort to manage the situation. Thank you. All right, so despite the increase of almost 50% of cases in the last week, there aren't any other measures apart from raising awareness which are intended at this time, if I've understood correctly. Well, as Dr. Tam and I have said, there are a lot of lessons that we've learned from the AIDS HIV outbreak, and right now we have the AIDS International conference which is taking place in Montreal. And we know that it's very important to raise awareness, but we also need to make sure that we don't stigmatize that population. So we need to continue to raise awareness amongst all Canadians about what the risks are and how we can minimize risks. But we also need to be aware that right now there are men who have sexual relations with other men who are at high risk. So there are two things that we can do, which is to continue to vaccinate and encourage vaccination, and also encourage people to change behaviors and practice safer sex.
Thank you. And I have two questions from Dylan Robertson with the Winnipeg Free Press. Dr. Tam, how many cases do you think we have in Canada right now, including those who haven't actually reported monkeypox? Is this multiples more? And could you maybe walk us through any modeling that you have?
I think that it's difficult to say, and there seems to be a range of symptoms. There have been potentially asymptomatic cases reported in the past in the global setting. We don't know if asymptomatic cases can spread the virus. although we know that the vast majority are through close, intimate contact, especially skin to skin, mucous membrane type of contact. So I don't know the extent to which cases may be underdiagnosed, underreporting, which is why we absolutely need to continue our efforts to increase awareness through trusted sources, so that we make people feel like they can access the health system and won't be stigmatized or otherwise negatively impacted, which is what makes it really difficult, I think, not just in Canada, but in many countries for this, to get a good account of how many cases we actually have. I suspect with, so many countries are now reporting cases, the virus has been circulating for a period of time, unbeknownst to all of us. But I do know that, the moment we were alerted to monkeypox, Canada's frontline health system immediately started diagnosing the cases. So I think if we should see cases in females, in other populations, I expect that in Canada we will pick that up. We're working with the usual networks to increase awareness. Globally, I suspect there's a significant underestimation. The modeling isn't maybe as helpful at the moment. There's still a lot of unknowns in the parameters. In general, I think many countries, and including certain areas of Canada, we estimate the R value to be over 1 in the currently most impacted groups, and these vary in terms of the estimates, maybe around 1.8. One person passing it on to over one person means that the epidemic can continue to grow, but that can shift with the application of vaccines and some of the public health measures and behavioral adaptations. So I don't know that I can tell you how many are sort of hidden under the iceberg. But I hope that in Canada, people are supported and feel safe to get themselves presenting and getting diagnosed, because we can help with treatments and we can help with vaccines.
Thank you, Dr. Tam. And I'm wondering if you could walk through how often you're meeting with chief medical officers of health on monkeypox specifically, and if you could walk us through any sort of items that come up on the agenda, including paid leave.
Yeah, so I would just say very frequently, we're on average, we're meeting about once a week around that kind of time frame. We had 1 or 2, maybe. We always maintain contact, not just through actual video conferencing, but other means of contact all the time. But monkeypox emerged, and we immediately started meeting and talking about this with all the other chief medical officers, and NACI and all of this, as you've seen, has been working really hard in the last weeks. So I would just say very regularly, and we'll be meeting again this week on monkeypox. So and which is why we've already set down the components of our response. From one thing that we did really quickly was to decentralize testing and enable provincial territorial laboratories to do their own testing, getting the vaccines and treatments out, getting guidance, as well as the surveillance and systems. But all of us are trying to work with community organizations. So these are the kind of things that we discuss. Yes, the discussions about how do we best support people to follow public health advice does come up quite regularly. I've certainly encouraged not just the federal government, but all levels of government to look at different ways that we can support people in having effective reduction in contacts in a safe way. So some of these are fairly practical things that are being shared between provinces as to how they're managing isolation and reduction of contacts in their own jurisdictions. So that kind of information sharing in a very practical way is extremely valuable. And we're all learning from each other at this point.
Thank you. And our last question will come from Dan Grummett of Global News. He's texted me the question because we're having so many technical issues. I apologize again. So his question is, Dr. Tam, you've said today that we need those in the high-risk groups to take up the vaccine. Here in Alberta, there have been complaints about access, and we've even heard reports of people in the 2S LGBTQ+ community flying out of province to get a vaccine. What do you think of that, and what should people do to access this in their home province? If access in their home province is an issue, that's all.
Yes, and I've been working with all chief medical officers. As I've said, they may or may not be experiencing different epidemiology. So please do contact your provincial chief medical officer of health because the epidemiology may be different. But I think our social networks are very highly connected across the country and also globally, as you've seen. So even if cases not seen in one area of the country, it may arrive at any given moment. So I do think that remaining vigilant but offering, increasing access to the vaccine is very important. So this seems to be a bit different across the country, and the local areas can comment more on that. I do know that some of the behavioral insights are very interesting in areas where there is access, but people are not taking it up. And so we need to continue to share that kind of research and information. Some of the feedbacks on the ground are simply about ease of access. Having more abilities to have walk-in clinics or access points. Many people who intend to get vaccinated haven't got vaccinated yet. There seems to be a reduction in people's perception of risk, which is contrary to, of course, the actual epidemiology, which is actually still going up. We're seeing new cases every day. So making sure people know that the risk has not diminished in the last weeks. We may or may not see some plateauing of the epidemic curve in some localized areas, but it's still too soon to tell. So don't let your guard down. Don't, properly positioning the risk to individuals and communities, and then providing the easiest way for people to get access to the vaccine seems to be some of the things that we still need to work through.
Thank you very much. Thank you, doctors. Thank you, journalists. We're not able to take any more questions due to a technical issue. I apologize again, but thank you for your time and have a great day.
Thank you, Dylan. Thanks.
Thank you. Bye-bye.